Alright, so today we will be discussing the EzPAP device, which is a positive airway pressure device indicated by the PAP. So as I'm demonstrating to this patient how this works, their incidence spirometry isn't effective by itself, so I would let them know that we're going to be using this EzPAP device, and what it's going to do is it's going to basically help the same way the incidence spirometry was or would by preventing any complications from developing. I guess you could look at some contraindications before that. So, before you enter the patient's room, you're going to check their history, and it'll be looking for like increased intracranial pressure, any facial trauma, let's see, say pneumothorax, just things like that. That would kind of be would go against when this treatment would help to treat basically. So if those are existing, something else will have to be done. But we'll say for this, for the sake of this check off or this video, that it is not occurring. They don't have any of these contraindications. So we'll say they are. Oh, what are we going to go with today? We'll just say in prevent or kind of reverse atelectasis, and we'll let them know that this will help them or help prevent any further complications from developing, or to help reverse anything that has occurred, such as atelectasis, which I'll let them know is their little alveoli, so they're like little sacs in their lungs that basically help transfer air or oxygen in and out of their body. And then, so an EzPAP will be this little device here. So, it has tubing, which will be connected to an oxygen source, which will be set at about 5 liters per minute. It'll have a little gauge, or you can attach a gauge if it helps kind of keep track of where that patient's at. That way they can kind of know where they're sitting and keep it in that area where they're supposed to. So about 5 to 20 centimeters of water pressure. So mouthpiece gauge, gas inlet. So basically, I'll have the patient seal their lips. I'll have them seal their lips around the mouthpiece tightly, and similar to the incidence spirometry. So if they're comfortable with doing that, but it's just not working for them, they'll understand. And I'll just have them breathe normally, kind of in a relaxed way. That way they can breathe in, and then they're going to breathe pretty much against the pressure that's going toward them, and they're not going to they're not going to be forcing air out, essentially. So that gauge will kind of let them know where they're sitting at. They're just going to breathe normally. We're trying to keep it in that 5 to 20 range. And that's about it with the EzPAP. It should help reverse that atelectasis any patient is experiencing. After this therapy, I would reassess the patient, kind of see where, if any secretions were mobilized, maybe have them cough, kind of listen to their lungs, see what's going on, see if it's helped a little, and just kind of document anything that has been found.